My name is Ahmed or Eddie Qureshi, and I'm the CEO and founder at Valorant Health. Formerly, we were Bettermeant, so you might know us from that as well. So a little bit about our team and company. We are working on innovative digital health tools that are AI enabled, keeping both the West Coast trend here as well as the AI trend alive with our pitch. We've been working on value-based outcomes for anybody that is working in government healthcare. So whether you're a provider, whether you're a patient, whether you're somebody who's interacted with healthcare, you've come across issues about how complex it can be. And we're making it more accessible, transparent, and cheaper. So Ben mentioned this briefly. We have been working with some folks in government already, with ACtWorks, with federal and local governments as well, to provide better behavioral health and telehealth tools. And we do have sole source designation, and we're working with some amazing folks for innovative capabilities within healthcare and data tracking. And we believe that by providing wider coverage within the government, we could save the government about $15 billion a year because healthcare is expensive. However, a lot of those costs can be mitigated by streamlining workflows and getting help where it is needed the most. Some of the government partners that we kind of foresee ourselves working with, DHA, Health and Human Services, and VHA, and we're working with some amazing folks already. So I thought what would be great is to consolidate how the user experience looks from our web platform. It's really simple, it's really easy, and you'd almost never know all the complex back-end stuff that we've had to do with our healthcare and compliance, managing permissions, tools, building a full in-house telemedicine capabilities, and being able to connect patients, providers, and to other providers to make healthcare workflows really simple and easy and built for intuitiveness. That's actually one of the biggest issues that comes across for healthcare. And we've built these tools that have become, both been tested and been increasingly more in demand under the last year and a half while we've been stuck at home. But this is not going to come as a surprise to anybody here that healthcare is complicated. If you ever tried to go for a visit, ever tried to take somebody else, it can be really complex. And our AI-enabled software helps consolidate that so that you understand what is needed from you on kind of a step-by-step basis. And it's wonderful is we are able to take all the entities, the payers, the providers, the patients, and everybody in between to help consolidate those workflows and make them intuitive. And so everything can move through as quickly and seamlessly as possible. Now, one of the amazing things is we are working with the government, but also the commercial side. So combining and bridging those resources from public and private sectors is not easy, but it's one of the things that we believe sets us apart and allows us to bring best-in-class care and coverage. So some of the things and what makes our platform unique is the ability to bring in artificial intelligence and machine learning capabilities to automate these workflows that are really complex and make them intuitive. And the way it plays out is to be able to consolidate everybody's health information so that you as a patient or your provider can get kind of the next steps in your healthcare journey. All of this obviously has to be done on HIPAA compliant, secure platform. We take that very seriously from the very beginning of our founding. That's been centered to the platform. And being able to combine the modern telehealth and automated scheduling just makes it that much easier so that when possible, people can just access care and coverage from the safety and privacy of their own homes. And so as we have been working and been talking about this, the way we work is we're able to combine our solution and make it accessible in real time for everybody everywhere because we're a cloud-based platform and we use actual clinically validated solutions to perform a lot of the work that we do. And again, the reason why I threw out that huge number right at the beginning was we believe that we can provide about 50 times cost savings for patients and providers by streamlining these workflows and consolidating them. We're already working with AppWorks. We also have a wonderful contract that we're working on with the Indian Health Service, which is part of Health and Human Services, over 5 years, providing better mental health and telehealth tools, again, to Native American tribes and Alaska Native peoples. And then on the commercial side, some of our best-in-class folks that we're working with on mental health capabilities and providers is Vita Health, providing all these amazing digital tools that have been shown and proven to work in higher medical to provide wherever there's need for additional resources. We also have not just a web-based platform, but mobile, because everything now has to be accessible. And this is actually a live view of our app. Wherever you are, whether you're on the move, whether you need something that's more general or a specialist, we are able to use our AI capabilities to actually help determine what is the best course of action for you as the patient, and we do similar with our providers as well. Now, just a small list of the amazing virtual programs that we have access to, accessing some amazing capabilities around sleep disorders, substance abuse, diabetes, stress and depression, things that might affect folks across the board and over time, and finding the right solutions really transparently and consolidating, again, that information so that it becomes part of your healthcare journey. Some of the benefits of our platform, just kind of summarizing it a little bit here, is the ability to provide that virtual care on a compliant platform. And we're really focused throughout the whole process on making sure that we're not just providing these tools, but encouraging and proving the better outcomes over time. And then with our monetization capabilities and offering this as a service allows us to consistently be optimizing and updating the platform and making it accessible across different IT infrastructure. And then, of course, at the heart of all of this is to lower costs, make it more accessible, make it more transparent as we continue to move forward. And again, Eddie Crashy here at Valorant Health, and happy to take any questions. And we're always looking for partners across the government and commercial spaces.